joining us from other areas of the country. Thank you so much for joining us today and being here. My colleague Marion will be popping on with us in just a few moments. And we are so excited to be here with you today and for the opportunity to interact with our future CryoCell families. We love even more really having the opportunity to educate our expected parents on cord blood and this very important decision that you're making right now. Our main goal today is to really just make sure that we can answer some of the basic questions from what these cells are, why you should store them, and the process from your enrollment all the way to the storage of your baby's precious cells. Now, we know that you're making so many decisions right now as an expected parent. And Marion and I know that one of the most important decisions that you can make is storing these precious cells for your little one. It is hello from Texas. It is your one time to bank these precious cells and to safeguard your family's future health. So before we get started, I'm just going to take a quick moment to introduce myself. And when Marion joins us, we'll take a quick moment to for her to be able to introduce herself as well. But my name is Jamie Anderson, and I am a cord blood educator. I have been for a little over a decade now. I've had the privilege of educating families, not just nationally, but even internationally. And I also work with providers all over the country in order to encourage and educate and provide more information about really what is happening in the field, just like we are going to have an opportunity to do with you today. Now, you will also see Valeria in our chat. Valeria is going to be answering or adding some additional information and links for you to be able to go to. So please definitely take a look at our chat so that you can get a little bit of additional information. Please don't hesitate to ask questions as well. Now, let's go ahead and get started and talk about these cells and CryoCell. I do want to make sure that each of you stay tuned with us at the end of the presentation, because we are also going to go through some special pricing just for you. As a Prego Expo attendee, you are going to benefit from additional discounts and incentives that really make cord blood and cord tissue banking affordable for everyone. Now, moving forward, we would love for you to also join us and like us on all of our social media pages, facebook.com/CryoCell, and then our Instagram, CryoCell International. Now, we are having a special on our Instagram for our Prego Expo attendees. For those of you who like our page and send us a quick DM that lets us know that you attended the Prego Expo, you're going to be entered to win an Amazon gift card. And let's face it, with little ones coming, every gift card from Amazon is a welcome gift. Okay. So we're going to get started. Again, I know Marion is going to be joining us here in just a little bit, but let's go ahead and dig right in. Let's start at the very beginning. I hear it's a very good place to start. So let's talk about what is cord blood banking. Well, cord blood banking is the opportunity to save your baby's precious cells. And it's all of the remaining blood that is in the umbilical cord and placenta. And you would also have the opportunity to save the cord tissue itself. And cord blood and cord tissue banking is the ability to have these precious cells saved so that in the future, if there is a medical challenge that your family faces, you would have these stem cells for future use. And we're going to get into it a little bit further, but these cells, both the cord blood and the cord tissue, are cells that are being utilized in multiple accepted therapies as well as clinical trials. So that kind of brings me to, I think the next logical question is, what are cord blood stem cells? So cord blood stem cells, again, are the stem cells that are inside the umbilical cord blood. And it's the remaining blood in the umbilical cord and the placenta. And very, very rich in these stem cells that have been successful treating over 80 life-threatening diseases already. Just to name a few of those, it's things like lymphoma and leukemia, Fanconi anemia, Hodgkin's disease. The list goes on and on. There's actually, if I were to spout out all of the 80 life-threatening diseases, you would get tired of hearing my voice. So definitely check out our website. We have a full list of all of those diseases that is constantly being updated, just as the field of cord blood is constantly advancing. Now, you've heard me talk about cord tissue a little bit. So let's get into that. What are the differences between cord blood and cord tissue stem cells? Well, the cord tissue stem cells is a piece of the umbilical cord itself. And the umbilical cord was actually found to be extremely rich in mesenchymal stem cells. And mesenchymal stem cells have been extremely successful with regenerative medicine. So that is what is in our medical future and will increase what these stem cells are going to be used in treatment for your family for years to come, right? Regenerative medicine treatments include things like type 1, type 2 diabetes, Alzheimer's, traumatic brain injuries, multiple sclerosis, heart disease, stroke. And oh, you're welcome, yay. And these cells have the ability to treat, again, with even traumatic brain injuries, speech apraxia and anoxia. These are treatments that are going to be used even more as our time goes on. We've even seen over the past 12 months, the cord tissue stem cells be very successful in treating patients with ARDS, the acute respiratory distress syndrome, which we've seen with many more patients having been diagnosed with COVID-19 and on a ventilator. So these tissue cells are very important to have an option to add to increase how many family members can utilize those cells and how many times that those cells can be utilized. But I think I talk about this the entire time, but why should I save my baby's cord blood and cord tissue stem cells? Well, again, it's your one chance to save these cells, to have them for potential treatments in the future. This is the opportunity to have these cells that your family could potentially benefit. And the one time to be able to have those collections. So we've talked about why bank. Let's talk about who. Who can use my baby's cord blood and cord tissue stem cells? So I think this also goes back to why should you store your baby's precious cells? And Casey, I see that you are asking about the delayed clamping, and there are options for families to be able to do delayed clamping and and have those cells stored and collected? We'll talk about that in a little bit, but it's a great question. Now, who could use my baby's cord blood stem cells? Those cells, the cord blood itself is it's an exact match for the child. A full blood sibling has a 30% probability of being an exact match or a close enough match to be able to be used in treatment. Many of the units that CryoCell has released already have been for sibling transplants. Parents are called a haploid match. It's a 50% guaranteed match. And once you get into grandparents, aunts, uncles, and cousins with cord blood, the percentage decreases, but there have been cases of family members being able to be an HLA match and have those cells utilized in transplant. Now, the cord tissue match is just a little different because the cord tissue is any first or second degree relative. The cord tissue match does not have to be matched like cord blood. It is parents, grandparents, aunts, uncles, and cousins. So again, when we talk about Y-Bank, there are family members that may be able to potentially benefit from these cellular therapies. And who could benefit, but many of the possible family members. So I believe Marian, again, she will be joining us here in a little bit. So I know there's a question about an HLA match, and an HLA match is our protein. So everyone has a unique protein when they're born. We get 50% of our HLA from mom and 50% from dad. And that's what this is. These cells are matched on when they're needed if it is a sibling match. Again, baby, the 100%. Siblings have that potential of being a perfect match or a close enough match. And then parents are guaranteed for that 50%. So once we decide to go ahead and store those cells, let's talk about how long do cryopreserved stem cells last? Well, scientists in the field believe that these cells have a potential of a lifetime, which is why the family, actually the doctors in the field and the field of cord blood has really opened up into later in life medical challenges. We know that Matthew Farrow, the first transplant in 1988 for the treatment of Fanconi anemia, but since then, we have proven at, I believe, 27 and a half years, the cells have been thawed and used in treatment with a 99% viability. And I believe Dr. Hal Broxmeyer is the doctor who has stored cord blood for the longest, and his publication, most recent publication of viability, was a little over 33 and a half years. So these cells have that potential of having a lifetime of viability. So when you're looking at storing your baby's precious cells, you're really looking at storing for a potential long-term storage. Now, how many uses can I get out of my collection? Well, with cord blood, we have at CryoCell a game-changing storage bag. It is a 5-chamber storage bag. And that 5-chamber storage bag has the potential of being utilized 5 separate times for treatment. Additionally, on the very top, I wish I had it to show you. I know Valerie will put a link in there, but absolutely take a look at the 5-chamber bag. It is what you need to be storing your baby's precious cells in. There is an antiquated older cord blood storage bag, which is an 80%, 20% split. The 5-chamber cryo bag really takes it to the next level of possibilities for storage. Additionally, the tube at the top has 5 aliquots that could potentially be utilized for cellular expansion, even adding to how many times those cells could be used for transplant. Now, the cord tissue is stored in 2 cryovials and will just depend upon how many cells are needed for the transplant with the cord tissue. And I do see Valeria put a link to that. It is so incredible, this 5-chamber cryo bag. It is absolutely what you want your baby's precious cells to be saved in, so you do have that potential for more than one use. Now, how is the cord blood and cord tissue collected? It's very simple. And when I had my little one, I was very hyper aware. I wanted to make sure that I saw everything that was happening. And honestly, you are beginning those first moments of being a parent, and you probably won't even realize it. The umbilical cord is cut. Your provider collects all the remaining blood and the umbilical cord and placenta. There is no harm to you or the baby. It is, it's done while you're enjoying your family. Now, the cord tissue is just collected and it is placed inside a sterile specimen cup. And all of that is placed into the shipping container, which is then sent to our lab for processing and cryopreservation. Now, for those of our families here that are ready to enroll, here's a great question. How do I enroll and get more information about cord blood banking? Well, I'm glad you asked. So Marion and I are so excited to be able to assist you. It only takes 10 minutes to enroll. We just get a little bit of information and get your shipping container out to you. Now, this shipping container is so important. You want to make sure that you have that in case your little one were to go early. So we typically suggest 60 days prior to your due date, go ahead and make sure that you get that kit. If you are within that 60-day window, we are more than happy to make sure that we are expediting that kit to you at no additional cost, because it's just so important that you have the kit with you to take with you to the hospital so that you can have the opportunity to save these precious cells. Now, you can contact Marion and myself, and I know Valeria is going to put our contact information in the chat. And additionally, we do have customer service representatives that are here almost around the clock to take your call, because we know little ones are on their own time schedule and we want to be able to assist you. Rebecca, I hope you are thinking about cord blood banking now. It, again, is just such an important decision to be able to have these for your family's future. Now, before we end, I just want to go through a few more frequently asked questions. What happens if I were to need the stem cells? Well, we at CryoCell have a nurse, Melissa Warren, who works exclusively with our transplant families, and she walks you through that process. We help to make sure that your transplant facility has all of the information that they need, and the unit is released and sent to wherever in the world the transplant is taking place. Now, why is CryoCell International the leader in stem cell banking? This is really the big question and the easy answer. CryoCell International was the very first bank. We were established in 1992, shortly after the first transplant ever took place, or did take place in 1988. And CryoCell saw the vision and the possibilities and what these cells were going to be able to do to safeguard families' future, to be able to have them to assist families in their medical needs. And since then, we have gone on to release units for transplant all over the world, being able to help thousands of families. Now, another thing, we have our transplant record on our website for you to take a look at. You can also email Marion or myself, and we're happy to make sure we get that to you. Our transplant record speaks for itself. We have a 100% success rate in releasing cells with viability to be able to help families around the world. Now, lastly, but not least, I want to share with you the special pricing that you as a Prego Expo attendee will be able to receive. So right now, you can lock in cord blood banking just starting at $680. Now that's for the enrollment fees, processing, medical courier, and your first year of storage. So annual storage fees don't even begin until your baby's first birthday. And then it's just $175 a year to continue to store. For cord blood and cord tissue banking, it is just starting at $1,225 with your annual storage fee, again, beginning around the time of your baby's first birthday at $350 a year. Now, this is a savings for your family of well over $1,000 off for the enrollment fees and the first year of storage. And we have additional discounts for a prepayment of annual storage if you choose through your baby's 18th birthday or through a lifetime of storage. So there are discount options available for all the run. Now, there's also payment plans available for your family. Please reach out to Marion and I, and we are happy to make sure that we go through all of, the payment plans, gift registry. We are going to be at the booth answering all of your questions as well. So at 12:25, in just a few moments, I want you to hop over to our booth. Marion is going to be live, and she's going to be chatting with you about all questions, pricing, discounts. Want to make sure that you have everything that you need to make this important decision. And just know that Marion and I are here throughout your journey to support you, to make sure that we have answered every question that you have and that you are ready for your big day. Well, at least as much as we can help you with. If you are considering cord blood and cord tissue banking, and we hope that you are, we would recommend that you do this for your family and store with CryoCell, where we will protect your baby's cord blood in the event that you were to need those cells for any life-saving moments in your future. And with these discounts happening with the discount code PREGO50, that's PREGO 50, I know that you would be able to take advantage of these savings for the future. Now, for the first 20 moms or dads or families that enroll with us, not only are you going to get these fantastic savings, but you're also going to receive a $50 gift card to Amazon. So we are rewarding you in every way, and it, again, just helps with baby's future needs. So I do see, Nicole, you were talking about 18 years and lifetime plan. Absolutely. We do have those discounts for the prepaid plans. Marion and I would love to be able to reach out to you to kind of go through all of that with you as well. Now, be sure, again, to pop over to our booth with Marion, who is live in just less than a minute. And she is going to continue on and answer more questions. Thank you so much. I would love, Campy, for you to be able to store with us as well, your little one. And last but not least, most importantly, Congratulations, each of you, on your upcoming deliveries. And we will absolutely look forward to working with you and speaking with you and chatting with you soon. So thank you guys so much. Michelle, I agree. The technology is amazing. Thank you. Thank you, guys. Have a great day.